Says paying for their son's insulin forced them to make hard choices, but a new bill in Congress could mean relief is on the way. Lauren Petty has their story.
Hey! Why did he do that?
Joey loves video games like most 5-year-olds, but most children don't have these monitors.
Look at your diabetes.
Diagnosed with type 1 diabetes nearly 2 years ago, Joey relies on insulin.
Every time he eats, he needs to get some sort of insulin put in.
But just one vial is expensive.
This is what you pay $60 a month for.
And that's with insurance.
We've pretty much cut back on everything. I mean, the total cost with insulin, I mean, you spend well over $13,000, $14,000 a year.
We have seen a steady increase, dramatic increase in the cost of insulin over the last 20 years. It's time to do something about it.
That's why Senator Dick Durbin is supporting bipartisan legislation in Congress that would speed up FDA approval for generic insulin.
Competition is the best way to bring down the price of drugs.
Every time I meet with families, this is what people want to talk about.
The executive director of the Juvenile Diabetes Research Foundation says several JDRF families were in Washington advocating for insulin affordability and other issues.
We found a study that 25% of people with diabetes are rationing insulin because of the cost.
He's a hugger.
Joe Anglima says his family will continue to make sacrifices to ensure Joey gets the insulin he needs. Hopeful relief is on the horizon.
I'm extremely hopeful for my sake, for other families' sake, for my son's sake.
Now, there have been other measures introduced in Congress to help with insulin costs before, but Senator Durbin said he's hopeful this one will pass because it has bipartisan support, including from the president, who says he also wants lower prescription drug costs. Many children who have their tonsils removed are still being prescribed opioids despite recommendations against it. Researchers at the University of Michigan looked at almost 16,000 children who had their tonsils taken out, and 60% of them had at least one opioid prescription filled. Many experts recommend using less powerful and addicting drugs like ibuprofen instead. Researchers say overprescribing opioids to children isn't just a health risk to them, but to family and friends who may have access to their leftover drugs.